Hi everyone.
There you go.
Hello.
Hi. Thank you for being here at Big Dream Studios today with the Happy Healthy Teeth Show. My name's Crystal and I'm here with Melissa and Christina. We are all dental care managers with UPMC. We are also here with our dental resident, Dr. Murphy. Thank you so much everyone for being here, and thank you friends for joining us. So here at the Happy Healthy Teeth Show, we talk anything teeth, and today we're going to talk about orthodontics. As hygienists, we are asked often by parents and patients, should I have braces, and what kinds of things would facilitate me needing braces. And the American Association of Orthodontics, they recommend a screening by around the age of 7. So if you're 7 years and above and you have questions about should you have braces, you could go and see your orthodontist. Now we have some examples of orthodontic treatment here with us today that were provided for us by Dr. Cole, Dr. Nate Cole and DuBois. So thank you, Dr. Nate, for sharing your examples of braces with us today, so we can show our friends and our teammates the different types of things that you do. So people talk about Phase 1 and Phase 2 orthodontics. Have you heard of Phase 1 and Phase 2, Dr. Murphy?
I have. So they're very important, and the timing of those are pretty different. So Phase 1 is a lot earlier. We typically do that whenever you're, like she said earlier, 7 years old, 8 years old, whenever a certain number of teeth erupt. And that's more for getting things like expansion. So if your teeth are too big for your mouth's a little smaller, we can make your mouth bigger so that the teeth fit nicely. And that's more of what Phase 1 is all about.
We actually have a picture of Phase 1, Dr. Murphy, we can share with our friends. So the picture of the crowded teeth, what Dr. Murphy was saying about how you don't have enough room for all of your teeth, so they put a small appliance in there that takes a little key that you turn and it makes room. It works with your growth and the way your jaw grows, and it helps make space. So these are examples of little expanders. So we have the picture there, and then this is a picture of a little expander with the bands that go around the tooth, and this is where the little key fits in. And this would be a removable expander where these fit over little bumps that the orthodontist bonds on the teeth, and then they use the little key there. So then after they make room for all of the teeth, and the patient can have their adult teeth erupt into the proper position, Dr. Murphy, is that when you would go into Phase 2, or do you wait a little bit?
Yep, so that's exactly when we go into Phase 2. It's whenever all the permanent teeth are in and we've made space with our expanders and other appliances. And once there's enough room in the mouth for your teeth, then we use Phase 2, which are the braces that everybody has seen, to align all the teeth to that perfect smile.
So we have some examples of the different types of braces that you can get. So there's the metal kind, and then there's these clear braces.
Mm-hmm.
And our friend and coworker Christina, she recently had orthodontic treatment. And what kind of brackets did you have, Christina, when you had your braces?
I actually had the traditional metal brackets,
So she had these ones.
but I still did get to pick different colored bands to go on those,
Yeah.
just like you see on the clear ones.
So what was your favorite thing to eat when you had your braces?
Well, when I first got them on, my mouth was a little bit sore, so for the first few days I ate a lot of soup, and a lot of yogurt and applesauce, but after that I was able to resume a normal diet. Of course, nothing real sticky or chewy.
Yes. For our activity today, we're actually going to pretend that we're putting braces on these teeth. So you all should have gotten glue dots in your little kit and your little chomper teeth and a little string. So if you want to take and start putting your glue dots on the teeth, that's what your little string goes into, and that glue dot actually represents the brackets that the doctor uses. So if you see these, the brackets glue on the teeth with special tooth glue, and these are just little glue dots that we're going to put on our pretend teeth. You don't ever want to put glue dots on your real teeth.
No.
No glue dots on your real
dots
teeth.
on the real teeth.
The dentists only use special tooth glue to put on brackets, or special glue when they fix your teeth. So glue that you have at home doesn't work for your teeth. Don't use super glue or glue dots or anything on your teeth. So once you're able to get your glue dots on your teeth, you can start to put your little string around there. And brackets usually go in like the middle part of the tooth. So if you imagine like a cross on a tooth, that's kind of where the bracket goes. And these teeth are kind of straight, so it doesn't really represent what somebody would be going through when they had orthodontic treatment, because when the doctors are putting the brackets on the teeth are not straight. And different types of wires. So patients ask me, how do the teeth move whenever they have braces? So I know about different types of wires. Dr. Murphy, if you were to explain how tooth movement works, what would you tell our friends?
Yeah, so teeth move a lot with pushing and pulling. So they have to move through bone just like any other, bone in your body. Whenever you push on the tooth or pull on the tooth enough, the tooth just moves alongside that. Now the different wires just depend on what kind of movement you want. So if you want the teeth to come out this way, then use a certain type of wire. If you want them to push back a little more, you get to use a different kind of wire. So there's different kind of wires for different kind of movements, as well as things like springs to push, really far away, or like coils to pull things closer. So.
Oh no, can you guys see those little springs on there? Yeah. Dr. Cole was able to give us some really neat things to look at, different examples of ways to move the teeth. So Christina, when you had your wires and they changed them every month, can you tell our friends how that felt?
It didn't really, I'm trying to think it's been a while. Sorry. Caught me
Feels
off
tight?
guard. It did feel tight. And, when they would take that wire off, you could feel your teeth again, which is weird because when you have your braces on, you can't run your tongue over there, but there's all those little bumps of the bracket still there. But when they would change the wire, every time they would put a new wire on, it would feel very tight initially for a day or two, and then your mouth adjusts to it.
Yep. So then once you go through orthodontic treatment and your teeth are nice and straight, the orthodontist will take those braces off and clean off all the glue and take impressions, which could you tell our friends about what an impression is like?
Sure. What an impression is like is they take a tooth form and they fill it with, think like something that's like putty, Play-Doh, slime consistency, and then you push it into your mouth and then it hardens, and then when they pull that out, they use that to make a mold of your teeth, and that's how they would make an impression. So it feels a little bit gooey in there at first, and you just want to make sure you just relax and breathe through your nose while they're taking that impression.
So when they take that impression, and Christina said it makes this perfect little imprint of your teeth, they'll make you something like this. This is a retainer. So this is called an Essex retainer, or just a clear retainer. And they also make these metal retainers. These are called like Holly retainers. So Dr. Murphy, do they use different types of retainers for different types of orthodontic cases?
Yeah, so we do use different types of retainers. A lot of it depends on how much we moved your teeth. So if your teeth moved a lot, then we have to usually use a stronger appliance to hold your teeth in place. So that would be like your Holly, the TPA, things like that, that are metal and keep things in place a lot better. Now if the teeth were just, moving just a little bit to be a little straighter, then we can use our clear aligners, that you wear at nighttime before bed to keep the teeth in place that way.
Okay.
So Dr. Murphy, I have a question. A lot of parents would ask me in private practice. They always felt like you didn't have to do top and bottom. They would say, well, just put braces on the bottom. Do you want to explain why you have to do both?
Yeah, because your teeth always have like a place where they lock into place. So if you move the bottom out, the top teeth have nowhere to lock into. So you have to move the teeth together. That way they always have that nice locking place. Or else your teeth aren't happy, then your jaws aren't happy, and then you're not happy.
So the teeth kind of mesh together. I don't know, you can zoom in on this and show, this is the way teeth mesh together. They mesh along the sides and in the front. So your teeth have to fit together to work properly. And that's a nice mesh right there. Well, Dr. Murphy, we had some friends today after playing bingo that had a couple of questions for you.
Okay.
And Miss Lily wanted to know what you do if you have too many teeth and not enough room for them. How do you fix that?
So if there's too many teeth and not enough room, there's a couple of things we can do. We can either, like we talked about earlier, make room for those extra teeth and kind of leave those alone if they're not bothering any of your adult teeth. Or any of the other teeth around them. The other option is we send them to the tooth fairy a little early, depending on how many more teeth we have and how close together they are with the other teeth. So sometimes the tooth fairy has to come visit and grab those other teeth
And wiggle them out early.
and wiggle them out early.
Okay. Or you can get these expanders to
Yeah.
make room.
To
One
make
or
room
the
for the
yep.
extra teeth.
Yep. So then Henry wanted to know how long you've been a dentist.
So I have been a dentist for 2 years. Yep. So I went to dental school for 4 years, and then came straight out of dental school and went to this residency, and I'm in my second year of this residency now. So I've been a dentist for 2 years.
So if you are, here in the hospital and need dental care, they can call the dental clinic and,
They can, yep.
and visit you at
We're
the
right
dental
on the
clinic.
third floor Bear Clinic, so they can either come down or we come up and we can do dental exams and make sure your teeth are nice and healthy.
So speaking of healthy teeth, when you're going through braces as a hygienist, I noticed that patients who have braces struggle sometimes with keeping their teeth clean, and I know that can make for an unhealthy condition. Christina, when you had your braces, what are some of the things you did to help keep your teeth super clean and healthy?
Well, I tried to brush after every meal because every time you eat, you're going to get things stuck around the brackets. You just can't avoid it. So brushing as much as you can, twice a day is the gold standard, but with braces, the more the better. An electric toothbrush really made a difference. It made my life so much easier. And when I did brush just with a manual toothbrush, they didn't feel as clean. So I tried to take my electric toothbrush, with me whenever I could and use that all the time. And flossing is probably the dreaded thing that nobody likes to do it when you have braces because it's not easy. It takes a little bit of work. Takes a little time to get used to flossing braces, but I did find online platypus flossers, and it's like a little floss device that made life much easier. You can slide the floss like right underneath the wire and floss your teeth that way. So that was a game changer. It really made life easier.
Water picks can be another good
Oh,
flosser,
good
as
point,
long as
Melissa.
mom and dad don't mind the splatter on the mirrors from it.
Yes.
Water picks are good.
I agree. They do work as well. They're very messy, but
Yes.
they work.
So sometimes with braces, if you get a little bump to the face, they can injure you. So we always want to wear a mouth guard when we're playing any sports, especially when we have braces. But Dr. Murphy, if you had to give somebody advice as far as what you should always have in mom's purse if you would hurt your mouth, what's something you would recommend that people always carry with them?
Yeah, so there's a few different things that you can do whenever you get an injury to your tooth. A lot of times, like the facilities or like your sports places, doctor's office, things like that will have like some Hank's balancing solution, or like even like milk, anything that you can put the tooth in if you were to knock a tooth out, and then bring it to the dentist as soon as possible. So sometimes even if you bump your tooth and it comes out, you can just even put it right there in the pocket of your lip just keep it moist with saliva, milk, anything that's going to last until we get to the dental office. Other than that, pretty much if you bump your tooth or anything with braces on it, a lot of times you just get like a little cut on your lip or things like that. So sometimes you can just hold pressure until you can get to the dental office, and that'll just be with like a little piece of gauze or anything like that.
I know for patients that have knocked a tooth out, a lot of times they put braces on those teeth to stabilize them afterwards. So you may not be planning on getting braces,
No.
but if you have a significant injury, you may be getting them to stabilize your
Yes,
teeth.
That's right.
So what about, Christine, have you ever used wax? I've heard people use wax on their braces. Did you ever use wax for anything?
I have. Occasionally the wire would maybe come out in the back and that would eat away at your cheek and make your cheek become sore. So a little bit of wax until you can get to the orthodontist to have that wire corrected definitely helped.
Perfect.
And you can usually find that at the dental section, like at Walmart and your local drugstore. And that's something I would think maybe too, depending on the injury, if you bumped it, you could knock your wire out of place. And you could also get, a little cut that way if you injured it. Just didn't knock the tooth out, but you might knock the wire out.
Oh, or break the bracket off
Yeah.
your tooth. So that's a visit to the dentist,
Yeah,
correct,
to the
Dr.
dentist.
Murphy. Yep, off to your orthodontist you go.
How about if they get bumped, soft tissue, they don't knock the tooth out, but the gums are all cut up, would you recommend?
Yeah, so they can put a little ice on the area that kind of helps with like the swelling, kind of helps with that discomfort. With the tissue on the inside of the mouth, the gums and the lips and everything all heal very nicely. So it is very important that you go see like a doctor or a dentist just to make sure you don't need stitches or anything like that. But a lot of times that just heals on its own. It's just a matter of stopping any kind of bleeding, and then just making sure it's nice and comfortable until it heals.
Good.
So ice, parents, and ice. Keep ice with
Ice,
you.
ice. Yeah.
Ice, salt water, and wax. And in your doctor's phone number.
Yeah.
Well, thank you, friends, for being here with us today, and I hope that we were able to answer, maybe if you had any questions about ortho, I hope that we were able to address those. And remember that Dr. Murphy's here in the hospital if anybody needs dental care, and we'll see you guys next month.
All right.
Okay.
Bye.
Bye.